Hello, 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 everyone, and welcome to another episode of The Heart of Innovation. This week, it is a very special Save My Piggies episode where we are featuring a mother and daughter who are going to share their amazing limb-saving journey. But before we bring them in, I want to give a warm holiday welcome to my amazing co-host, Dr. John Phillips. And it looks like you are moving on in Movember. Big time.
I,
He's
I,
got a beard for those on the radio.
well, I don't know if you could call it a beard. There's a fair amount for a
It's
goatee,
getting
and then
close.
like just
Yeah.
little patches here and there. I, so November Men's Health, kind of awareness month, prostate cancer, all sorts of, men's health issues. And we're raising money for, a particular, there's three people in my clinic, myself and two other guys. We're all growing beards, and the person that has the best looking beard, as voted on by, I guess, the public or those that follow us on Instagram and Facebook, get to donate a certain percentage of proceeds from this month's patients to a charity of their choice, cancer of their choice. And I'm picking prostate cancer if I win. And I'm also taking whatever the proceeds that we generated through sales. I'm going to double that and send it to PD awareness. So another plug out to those that potentially want to get involved. But I think, no, as we try to raise awareness for men's health, I'm always trying to raise awareness, and you are as well, to or folks with peripheral arterial disease, and we're trying to save the piggies. And it sounds like we have a pretty good show lined up for today. So I'm excited to talk to these two ladies.
Me too. And, overall health is so important. And we do have quite a few patients that have had cancer. They ended up with the radiation damage to their arteries, and they end up with peripheral artery disease. And so there is a lot of crossover there as well. The chemo, the radiation, all that can lead to inflammation in the arteries and therefore some plaque buildup and blockages. And so I think everything just kind of aligns, comes together. And so it's important to raise awareness for every single aspect of health and
What
how
is
they
your
intersect.
is dad doing anything for Movember? He's a clean shaven guy, isn't he?
Oh, he is. The one time he did grow a beard, it was my mom had it off literally within a few months.
Well,
No, he shaves every day.
that is weird because my dad had a mustache his whole life, except he shaved it one time, I think when I was in high school. And we're like, you got to grow that back. Because it's so, you get used to seeing somebody look a certain way and then they change it.
Yeah.
You're kind of not, it takes a while to get used to. But after a while, I guess you can get used to it. But this thing will come off December 1st.
Yeah, I'm sure your wife is probably she's counting down the days. But
My
with Movember, one of the things that we did last year, which was really exciting, was the men actually grew out their beards and the women with PAD, with peripheral artery disease. One of the symptoms of peripheral artery disease is the low hair growth. And our
yeah.
patients talk about a lot when they get excited that they have more circulation after they have a procedure. They've been walking a while. Walking's the best medicine to grow those collateral vessels, to reroute blood flow around those blockages. Well, their hair starts growing on their legs. So I say, hey, ladies, let's not shave for the month of Movember. And that worked out really well
It's,
last year, but it wasn't popular enough to bring back again this November or
Depends on
November.
what part of the country, maybe, or a world, but
That's probably true.
nonetheless, it's.
It's probably true.
I think I shared this at one point in another video because I've had some patients, they're a little sheepish, like, "Oh, sorry, I didn't shave," and I said, "That's not a problem. In fact, it's like, to your point, if you see hair at the ankle, that's great, or 4 foot, whatever, awesome, because that means the first part of the body to go with PAD is hair.
And
So
I think that's
that's
the
awesome.
perfect transition into Nancy, although I'm sure she's sitting here going, no, 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 let's not talk about this hair growth. But I'm sure, Nancy, you can totally relate. And Rebecca, her daughter, welcome. She's sitting here laughing, right? It's true.
Yeah. Actually, I have hair on both legs. I would
Oh,
love
that's
to get
good.
rid of it.
That's good.
So, but it's not stopping. So,
You're like a chia pet.
Yeah.
yeah.
It's always a good sign. And it's so nice to see where you're at today and so full of life versus, where you were not even barely 1 year ago, when you and I first met through your daughter, Rebecca. I'd love to start this conversation, before your diagnosis of peripheral artery disease. What was your life like before you started getting slowed down by those leg cramps that are indicative of PAD?
Well, 4.5 years ago, and I'll start out by saying I ain't no young chicken anymore either. I'm 77, be 78 next week. And so I expected to grow old, but I didn't expect to grow old 4.5 years ago, or almost 5 years ago now. I got cramps in the back of my foot and in my right leg in the calf. And I kept looking for stuff out on the internet. What do I do? What do I do? And so Rebecca mentioned that she was going to a chiropractor who used laser. And I read that laser treatments help pains in your legs. So we went to him and he cured it. Just like with Dr. Minkus, I walked into his office dragging my right leg, saying, I am in such pain, I can't stand it. And I did a dance going out of there because the pain had stopped. But after so many months, it started again. And
So where are we? I want to go back because I think we're fast forwarding through your story, and I think we need to reverse just a little bit and go, okay, so you went to the chiropractor, an actual chiropractor, and so what did he use? Some sort of surface laser, some sort of
it's just a laser.
superficial?
It's an old laser. He'd had it forever. He assured me that it wouldn't hurt the good tissue, but it might go in and clear up whatever was causing the cramping. So
That's
nobody,
interesting.
from this has been all the way through. Nobody, even the top doctors that I saw, just did not know what PAD is, Pat. So anyway, so he was the first one I saw, but he's the only one that I saw that did not say, here's a pill, a pain pill, a pill, take this pill and it will do magic. So
But he actually diagnosed you with PAD, the chiropractor did?
Yeah.
Oh, he
I was
didn't at
gonna,
that point.
yeah, okay, that makes more sense
He
because
just
yeah,
thinks that there's
Yeah.
leg cramps.
He
So
was,
he's trying to cure the
yeah.
leg cramps.
He treats peripheral neuropathy.
so
Gotcha.
So he was just going with it might be some peripheral
might
neuropathy.
be that, yeah.
But it was a startling difference because prior to all this, she was so active. Like she never slowed down. She was out there doing everything. So it was like overnight, just
Right.
night and day difference.
And it was
Wow.
basically it was walking that was the big problem. And yet at night in bed, never had a pain. But during the day, the pain was there. And this continued for, a year or two. And eventually it just got worse and worse. So I started seeing other doctors. With the chiropractor, I got mad because Medicare did not cover some of the
Yeah.
machines he had me get up on. That the vibrating machines and all, I tried all of that in his office too. So I stood up there and then I was able to jump off, which he couldn't understand because with the pain I was having, that he kept trying to reach up to help me off, but I could hop off. But
Wow. And coming up right here on the Heart of Innovation, I think Dr. Phillips is eager to get in here to say, don't just go see a chiropractor, go see your doctor, your general practitioner first, and get that real diagnosis before you start looking to treat things going wrong with your body. So stay with us right here on the Heart of Innovation. Don't go away. We're going to find out when Nancy actually first got diagnosed and how. That's next.
I'm an avid hiker, and 3 years ago I had to give up hiking for a little bit and everything due to the lack of blood flow to my legs and stuff. Now I've set the goal of actually hiking the Appalachian Trail, which is 2,200 miles long. And I was just wondering, is there a way where we can actually hurt ourselves by walking too much or hiking too much?
In a short answer, no, not that I'm aware of. I mean, obviously, if you that's notwithstanding the normal ways of a human body. You know, anyone without pad could still hurt themselves by, you know, exercising and go pushing their body too far. But no, in terms of pad, there's no way you can kind of there's no harm. The pain that you feel, the experience that you feel when you walk, that is not meaning that there's any harm going. There's no damage in the tissues. It's just that it's the body trying to tell you something. And it's that analogy I've used before again of the baby. You know, when you've got a tiny baby, the only way they can communicate is through crying, and they cry to say I'm hungry. I cry to say I need my nappy change. I cry to say that they're tired, and that's the same as a muscle. A muscle is just crying because it's trying to tell you something, trying to communicate, and it has no other way. So yeah, no, there's no way to do too much.
Welcome back, everybody. Thanks for joining us. Another interesting Save My Piggies is underway. So Nancy, you got my attention. You said you went to a chiropractor, which I think is reasonable in the sense that you know, there may be some, I guess, musculoskeletal symptoms that patients can have as it pertains to PAD, and then certainly peripheral neuropathy can cause symptoms. But my question for you is, do you have any risk factors for peripheral arterial disease? So when we talk about risk factors, we talk about diabetes, smoking history, high blood pressure, high cholesterol, history of heart disease, any of those things at all?
Nothing. Been healthy. I did have polio when I was 8, 5, somewhere between 5 and 8. So we also had, I'm from a little island off of Virginia, and we did have encephalitis. It turns out we were all immune to it because we had horses and mosquitoes, and they did come through and test a lot of us and discovered that we had it at one time in our lives, but it was gone, and we were, you know, basically vaccinated.
Those aren't directly risk factors. Yeah.
Yeah.
Sure. No, but so then you, prior to having these cramps that clearly, as you describe it, are claudication. It's claudication. So pain in the extremity due to lack of blood flow when someone's exercising, symptoms relieved with rest. This was fairly abrupt onset or kind of slowly over time?
Abrupt. And I did go to, I did have a general practitioner, but I ended up several times at an urgent care where they'd see me because the general practitioner did not know what it was. And I think they found some sort of an occlusion in the heart somewhere, but it was never serious enough to worry about it. But they put me on pills, which was a symptom of every doctor that I saw. Every new doctor that I'd see would come up with a new pill. But my general practitioner put me on atorvastatin. I ended up in the emergency room with the urgent care emergency because my right leg was in such pain from the atorvastatin. And the first thing the doctor said, that a doctor I'd been to before who knew me, he said, no more atorvastatin, that's what's causing your pain. So I went off, it took me like a week or two to get over that. But every doctor from then on that I even saw a pain doctor who prescribed, what was it, Rebecca?
That was way later. Later. But
But still,
I think one of the things when she was going that partially was possibly delaying the diagnosis was they would, they would say like peripheral neuropathy, they would say atypical though, because because they thought it was weird. Well, she doesn't have diabetes, she doesn't have heart problems. I mean, if you look at the list of of risk factors, the only one she has is older in age. And then of course we've learned that younger people get it too.
Well, and especially since ultimately we discovered she wasn't hypercoagulable either, that it turns out it was really rock hard calcium that had been building up in the arteries for a very, very long time. And we always say with PAD, it seems in a lot of situations, it's like one of those overnight acute situations. It's almost like sometimes you're so busy and doing other things that you don't notice. Maybe you're slowing down, you don't notice the early signs, the early cramping, you may brush them off. And that's what I'm curious, Nancy, as well, is you went online, were you looking at increasing your potassium, eating bananas, drinking tonic water, pickle juice, using mustards and spicy foods to try and relieve the cramps at all, hydrating more?
Yep, yep. Rebecca
All of the above, right?
still gets after me on hydrating, but no. And then my right foot turned bright red, and it's about as red as the color behind your
Oh
screen
no.
there.
Yeah.
And the other one was never red, but this one was just very, very bright red. So anyway, if you've ever heard of some of the major doctors here in the area, there's Core Institute, there's Barrows Diagnostic.
Right.
I
We don't
saw
really want to get into the names of the
Oh,
facilities and how
sorry.
you were treated at each, but I'd like to know what was finally the catalyst of getting diagnosed?
The common theme with a lot of folks that we interview, I see in the office hospital, is the lack of a physical exam. Like if you have a blockage in your artery, your physical exam is abnormal. And so for any physician, nurse, anybody with a medical background that might be listening, it's okay to touch the patients in the office. It's okay to examine them, and it's a lost art, because if somebody would have examined you early on, they would have probably picked up if all these symptoms were related to a blocked artery, they would have picked up an abnormal exam, and that would have set you down a different path than the chiropractors and all these other kind of
Right.
circuitous routes that you took.
There's a spine doctor that saw me. A friend of mine suggested she'd had surgery from him, and so had her husband, and it had taken care of all the pains they had. So I went to see him and did a full exam and everything, and showed me the x-rays, because every single diagnosis I would get would say, oh, it's in the pain in the back, it's the L4 and the L2, and we can do surgery to. And he saw me because I was desperate by then, because every doctor does something different, a different specialty. So I saw him, he did a full set of x-rays, and he sat me down in front of his his computer and showed me there's just nothing in my back. He said my back was healthier than most people my age.
So can you get us to the diagnosis? Who finally did it and when?
it was her podiatrist that finally did a ultrasound.
Well, coming
Yeah.
up right here on the Heart of Innovation, we'll find out after this ultrasound what happened next in terms of treatment. So stay with us right here on the Heart of Innovation and our special Save My Piggies episode. Don't go away.
I had a young woman in her 50s whose brother had lost a limb, had a major amputation in the past, and she really, really didn't want this to happen to her. She again came from another hospital. She had multiple procedures, some open surgical procedures, a lot of endo procedures. She'd gotten to that point where she had far advanced gangrene of the foot up into the calf, all the way up almost to the knee. And I treated her with deep venous arterialization, and it went well in terms of the DVA, but it was a long road for her. Lots of debridements, lots of skin grafts, different tissue matrices we used. But after 9 months, we finally got her healed, and she's now doing really well. I'd have to show you some pictures someday just to really emphasize how far gone she was. People just looked at this leg and went, that's unsalvageable. But I mean, the lesson I took from that was there are very few things that are completely unsalvageable. And I think it's worth having a try, particularly young people who know what they're in for, who know what the journey is all about. If they choose to have a go, and deep venous arterialization is now a new tool we have to treat these no option patients, then have a go and see if you can pull it off.
Welcome back, everybody. Special Save My Piggies holiday episode. So to recap, Nancy, 4.5 years in the making, you finally got diagnosed with peripheral arterial disease, which is a head scratcher that took that long, but nonetheless, by your podiatrist. He ultimately, or she, did some testing that revealed there was a blockage. You then were referred to a vascular surgeon for presumably definitive therapy. Rebecca, tell us what happened next.
So she saw the vascular surgeon first, and then and he had scheduled a procedure to go in and unblock her and everything. So that came on a Friday, and I drove her to the procedure. And I'm in the waiting room. I've been told it's going to take like 2.5 hours, so they're going to take her off and handle it. And then eventually the nurse comes out to get me and says, and it was a lot earlier, and says like, okay, the procedure's done, come on back. And it started as the doctor's going to talk to you. The doctor's going to talk to you. Long story short, I get back in the room with my mom, who's laying flat, and the doctor never did come back in. And instead, next thing I know, I have the nurse explaining to me, yeah, so the procedure failed. He couldn't unblock her. So it failed. So you're basically going to take her home and keep her comfortable. She's going to lose her leg, and then she's going to die within 2 years after that. And that's all that happened. Nothing. Yeah. Nothing else could be done. That was it. And again, that was the nurse, not the doctor. Never spoke to me. And yeah, just let us out of there on a Friday afternoon.
There's a lot to unpack there. So obviously that's devastating news. And this can go one of two ways. You can take it for its face value and say, okay, I guess that's going to happen, or pivot to some other venue to seek medical attention. And it sounds like y'all did the latter, correct?
Yeah.
Rebecca did. Yeah.
Well, yeah,
basically, it was an angioplasty, and they basically ripped the tubes out of me as I'm strapped there. And that's when they told me what they told her.
But then, they told me later. But yeah, so I think she was, I was driving her home first. Obviously, we were both in shock. I think, she was sounding more like well, it is what it is. I've had a good life. She just was going to accept it. And I just, I was in total shock. And I went home and I started doing, I started pulling up websites and stuff. And I was just overwhelmed between the information I got. But then I'm out there on websites reading up, and I'm like, this just doesn't make sense. They talk about other things that happen before, before you go straight to amputation. And then it took me a few days, like throughout that weekend especially, I just was so overwhelmed. And then I don't go on Facebook much anymore, but it was like the following Monday or Tuesday. I said, well, Facebook has a group for everything. And I went on and I literally searched Peripheral Arterial Disease Support Group. And this is the group that came up, The Way to My Heart, and, requested permission for that. And then meanwhile, got directed out to the website. And it's just everything I was reading was exactly like what I was seeing on the internet was like in direct conflict with what we were told from them. So I just didn't understand it. And yeah, that's when it took me a couple of days of just kind of reading the posts and, reading the posts. And then I finally got the guts to start posting some questions, said, I'm doing this for my mom and everything. And then boom, like 15 responses. You need to call Kim, call Kim McNicholas. You need to call Kim right away. Call her.
That's padsupportgroup.org, padsupportgroup.org, and it'll direct you straight to this one where, call Kim with the Global PAD Association.
It's
and
like
coming up next.
Better Call Saul.
Exactly. Right here on the Heart of Innovation in our special Save My Piggies episode, you'll find out about this infamous call from Rebecca to the Global PAD Association's Like Saver hotline. So don't go away.
How many procedures are you willing to go through? Is it worth going through that many, or would you rather just
That's funny. Was it worth it? Oh yeah, I have my leg, man.
Amputation should absolutely, positively, 100% never be a first-line treatment.
What an incredible operation, what an incredible lab you have here.
Without a doubt, we're underdiagnosing peripheral arterial disease. It has not gotten the attention that it should because it is a killing disease, it is a disabling disease, and most importantly, It's a disease that we now have great treatments for. Okay, let's go to the next one.
They were going to amputate it, and I needed to consult with my family. Did I want it off here or here? You're just shocked. It's scary. I don't even know how to explain it. You're 42 years old.
We're waiting till people are at the end of the spectrum and almost beyond hope. There is good care available here. Closed minds are what we have to get rid of.
Welcome back to our very special episode of the Heart of Innovation, our Save My Piggies episode. We have both Nancy and Rebecca. Nancy, it took her 4.5 years to get diagnosed with peripheral artery disease, and she ultimately ended up getting a treatment for it. They went in with the wires and balloons and tried to open things up. The doctor couldn't do it, so they got sent away with amputation as their next steps, and it was horrifying. And Rebecca went across the web, ultimately onto Facebook, found a support group through the Global PAD Association, and she called our Leg Saver hotline, and she got me in London, where I was attending an advanced vascular conference run by an amazing doctor, Lorenzo Petrone, who's now in Italy. And I was sitting next to some world-renowned doctors, including vascular surgeon Peter Schneider from UCSF and the VA, and Dr. Michael Sia from Houston's UT Southwest. Amazing people. And I stepped outside. And Rebecca, it's your turn.
So that was a Friday evening, and it was like a day or two before that they had all posted to call Kim. And then it took me like another couple of days because I'm looking out there, here's the number. And it just, I think it took me a day. I think by Thursday, it still took me till Friday evening to get up the guts to call. And then I was thinking maybe I would get an answering service or answering machine, because then I'm thinking, well, I'm going to make this call. I don't even know what I'm going to say. But yeah, I called and Kim answered right away, said, "This is Kim." And, and I just was like stuttering everything out. And yeah, and, Kim.
Rebecca, I have to interject because I have to ask a question, because I feel like this is an interesting point that we could unpack a little bit. Is it a generational gap between you and your mom, in the sense that, so Nancy, you basically said, okay, I'm going to cash my chips in and just kind of let this, and it took you, Rebecca, to say, no, that's not where we're going to go with this.
Generational. I think it's more personal. My brother has always said about me, my brother describes his sister as like, a good day is the day I wake up ready for a fight.
Well, but so the rest of your sibling, so the other kids and siblings were okay with mom losing her leg?
So he didn't know yet.
He didn't know. Gotcha.
Yeah,
Okay.
he didn't know yet, but he's always said, like, a good day for me is a day I wake up ready to fight. And I just, I'll fight anything, and maybe it's to keep until I get an answer that I want to hear, kind of thing. But yeah, I just wasn't going to give up like that.
Well, it's, again, I hate to just dwell on it, but I see this all the time. It's often not the patient who is advocating, but it's a family member, a husband, a child. And I find that psychology is a little bit interesting, in the sense that there are patients out there, and Nancy, through no fault of your own, that will, I told this to a patient this morning, they will, if their doctor tells them to jump off a cliff, they will do that.
That's true of the generational. I wasn't even thinking of that. Yeah, like it's been my experience and training that the older generations will tend not to question a doctor. When a doctor says, and this is from when I used to work in hospitals and everything, that what a doctor says, they will just think, well, that's my doctor, they know best, and they won't seek a second opinion or question it.
She's a retired nurse. And so this retired nurse gives me a call over there in London, and you got me. You were ready to chat. And what happened during this call?
So first she tells me, sorry about the background noise. I'm in London, which of course flusters me even more now. And I'm going, oh, you can call me back. And Kim says, no, talk to me. And I'm just like probably just blurting stuff out. And I mean, she took what I was saying like very quickly, jumped on board with it. And she's saying, "Where are you?" And I said, "Arizona. We're in the Phoenix area." "Well, have you seen, I don't know if you want me to say the name yet.
Yep, you can say.
Okay. "Have you seen Dr. Kirk Minkus?" And I'm going, "Who? No, obviously not." And she said, "Oh, if you're in Arizona, you want to see Dr. Kirk Minkus." And then she's talking to me and she's like, "Here, hang on, let me text him." And she said, "If you don't, he'll probably call you today still." This is Friday evening. And she says he'll probably call you either sometime this evening or tomorrow early morning. And I'm like, "Well, Kim, tomorrow's Saturday." "Well, yeah. So he'll be calling you really early." And then she said, "Oh, wait, he's texting me back. Wait, hang on, he's calling." So she ends up putting Dr. Minkus on a 3-way call. And like now I'm really like just, overwhelmed. And before I know it, yeah, Dr. Minkus is on, listens to like just a few quick things and says, "I need to see her now. I need to see her this coming week. If not Monday, I need to see her Tuesday." And, and he told me call his office because his office was closed. He said, "Call first thing Monday morning at 8 a.m. and tell him you talked to me. She's got to get in right now."
And so what was the appointment like with that first consult? And we can talk about him because he's not here.
So we went in and, and I had brought her results from the ultrasound and everything. And he was assessing her. And I mean, this is early on when we first saw him. Her foot's still very discolored. And he's looking at her foot. He's looking at her foot. He's looking at the results. He's listening to the history of how long this has taken. And I mean, all the other doctors, they were referring her to everything except for vascular. Nobody was referring to vascular. They were suggesting podiatry, nerve, neurology, blah, 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 everything but vascular. Nobody ever stopped to think vascular. And so when we got in, we told him the story, and he's looking at the results by now. She's completely blocked at this point on the right side from her groin to her right toes. And yeah, he looked everything over and he's like, "Wow, I'm so sorry." He's like, "Somebody definitely did you a dirty, or as far as a few, like, he was astounded.
It's bad news, right? And so he ultimately went ahead and did a procedure. And he also said that it was a pretty tough case. He was able to get a little bit more of a trickle. But what happened after that actually was the greatest difference between the two doctors, which was, Rebecca, where he said there is hope for her, even though the procedures aren't working, which is walking, which is the first time that either you or Nancy heard that walking is the best medicine for PAD.
Right.
I started walking 10,000 steps a day and tracking it on my phone.
Which is amazing. And coming up next right here on the Heart of Innovation, we're going to hear a little bit more about what Nancy is doing now to keep her legs intact naturally. So don't go away on this very special Save My Piggies episode of the Heart of Innovation.
Your type of condition is called critical limb ischemia. It's the most advanced form of PAD, or peripheral arterial disease.
Every 4 minutes, there is an amputation in this country due to PAD and diabetes. We also know that 85% of these amputations are preventable with early intervention.
It's a flip of the coin. Patient prognosis is tied to whether or not they are referred to a true expert in the management of peripheral arterial disease.
Do you know if your physician is an experienced CLI operator?
When you're in the hospital dealing with doctors and stuff, you figure they know what they're talking about.
The skill level varies doctor from doctor and hospital to hospital.
Patients with limb threat are in constant fear. The depression that someone experiences after they lose a limb is equivalent to those of losing their spouse of 40 years.
I was stuck in a wheelchair close to 2 years and my husband had to quit work. I didn't know what to do at this point because we had nothing but infections and hospital stays and infections and hospital stays.
And they took one toe, another toe, and then it was another toe, and then half his foot before he was even diagnosed with PAD.
And all I heard was, "What are we doing here? Just cut it off. And I pulled the curtain back like, are you kidding me?
Do you really want to go through all that?
That's crazy. That's insane. The protocol is to send them to amputation. Always, always, always get multiple opinions.
We do have options. We need to listen more to our patients.
If you're going to chop off their leg anyway, why not just let someone else try?
This is the progression. First comes the wounds, and then comes an amputation. And I wasn't going to accept that.
So that's what it's like to try to save a leg.
Welcome back, everybody. Thanks for joining us. Special holiday edition of the Save My Piggies. So welcome, Dr. McNicholas, to the show. And we've kind of recapped during the break as to what transpired with respect to Nancy's peripheral arterial disease. Sounds like she had a fair amount of disease, both above the knee and below the knee. And there's a lot of times where I'm treating patients who have severe claudication that, we can't open up the vessel or it's just not going to stay open. But we recommend alternatives, and one of them is significant walking. And it sounds kind of like that's what your conversation was with her, and that she didn't have to succumb to a major amputation, which is huge for her.
Well, yeah, it was. And I wanted to make sure she was not going to go through that, because we have several different techniques that we use to be able to revascularize blood vessels that look like they're closed and can't be opened. It's just a matter of you dedicating yourself to trying to go after it and get them open. She had a particularly bad situation because she had complete blockage of her artery in her right leg from her hip down to her knee, and then she had kind of sporadic spider type artery vessels going down, collaterals going down the leg, and then down the lower leg and into the ankle and the foot. So there was nothing that indicated or demonstrated on our initial evaluation of her, a diagnostic angiogram that I did, that showed any normal major highways that went down her leg. So her entire leg was living on her profunda artery, which is a secondary accessory artery that comes out of the hip, goes down along the lateral side of the thigh, and has collaterals that come over and feed the bottom of where the normal highway should be showing a blood flow, and then has percolating spider vessels that go down the leg. That's not enough to really be able to maintain normal function of the leg, especially if you're going to go to Walmart and walk around. You have to go grocery shopping and walk around. You have to get up in the morning and do you have a life and function. You can't really function like that to any significant degree. If you're not sitting idle, the leg's going to start to hurt if you walk around in it. So we originally went in and took a look at her. I couldn't get down from the top down on the right, but I was able to bring her back and then lay her on her front, on her stomach, and I was able to go in through the artery in the back of her knee and go up that way, retrograde or reversed, and then get everything open that direction. And then we brought her back and we stented. I stented a little bit at the top in that second procedure. The third one we came back and stented a little bit more from the top all the way to the knee, and then I was able to get below the knee into the vessels that were below her knee that we couldn't see at all, that most physicians would say, can't see them, they're closed, they're dead, we have to amputate. And then we, in our training here in Phoenix, where we do our work, we say, nope, we're going to give it another chance, and we're going to try to go into this invisible area that we know where the anatomy is, and loop our wire and push through and see if it follows down the track that we would expect. And it did. It did on her. And it went through all the way with the posterior tibial and lateral plantar underneath the foot, the front shin artery all the way down to the top of the foot. And I opened up everything from her hip all the way across her knee and down to her toes. And she would have lost her legs if somebody didn't say, you know what, I'm going to make a little bit more of an effort. I'm going to try to do this the best I can for this patient and save their leg. And that's what we do. That's what I did with Nancy. And her anatomy responded beautifully. And so I said to her, okay, now, since we saved your leg, you need to walk and you need to use this leg and you need to keep the blood pressure going and you keep it going through the foot so we can maintain this limb and not have any amputations in the future. So she did really well.
Yeah, sounds like seriously yeoman's work going above and below. We talked before, she had no risk factors for PAD. Where did this come from? Do we know?
We don't always know. We don't always know, but we have certain things that we use to be able to evaluate people, their history, the background of diabetes, background of hypertension, background of any elevated cholesterol, smoking history, previous stroke, previous heart attack, any kidney problems or kidney dysfunction, and if they're over the age of 55. Interestingly, people that are diabetics, people that have kidney problems and have hemodialysis, or dialysis, they are more prone to having peripheral arterial disease. So anyone out there that may have diabetes or kidney problems, they should be checked for sure. Go ahead, Kim.
Nancy, my goodness, I think it was just we narrowed it down to at least what we know was just age. I mean, for her to be blocked up from groin to toe, that's rare for someone that doesn't have diabetes, that doesn't have chronic kidney disease, that isn't a smoker or former smoker. It's very rare. Or even someone that hypercoagulable, you see that in. But I mean, rock hard calcium.
At the end of the day, though, I mean, she's obviously very fortunate she ran into you and you helped her out. But the story of taking 4 years to make this diagnosis when I imagine she had an abnormal vascular exam from the get-go is befuddling to me. But it just speaks to the lack of awareness that not only patients have, but also clinicians who are treating patients. It's sad, frankly.
That's correct. And that's why I do what I'm doing right now. That's why when Kim calls me and says, I need you tomorrow, I say, okay, well, I'll be there for you, because we go out and we try to tell the entire medical community and the community of people that may need these services about what peripheral arterial disease is. And they need to understand it, because there are many physicians out there that still have the mindset of, we know what this looks like. We think you should have an amputation to be able to save the rest of your life and just take off part of your leg. We don't feel that way. We feel that we want to try to revascularize and prevent amputations. So we want to make sure that everyone knows about what we're doing so they can come to us first, and we can give it the best possible chance from an endovascular wire catheter approach before we take them to the ultimate end, which is losing part of their limb. So yeah, I'm glad that Kim did contact me, and I'm glad that she did find me.
Yeah, live when I was in London, and you were gracious enough to know that when I texted you that I was not messing around. I don't cry wolf. I needed you right then. And while I was in London, you got on that 3-way call with Rebecca, and you said, I need to see her. Let's get her done. And you were able to get her in there right away, which, blew all of our minds. And we do really appreciate your fast action on it.
It's no problem. Yeah, it's very gratifying for me as a physician to know that you put in a little extra effort and you find someone like these people that you send to me, among all our own patients too, and you can get in there, do what you've been trained to do, and save a limb. And they give you a hug with tears in their eyes. Thank you for saving my limb. Thank you for saving my life. That's what we live for. That's what I live for. And that's why I do what I do.
And they actually took it very seriously. There are a lot of doctors that keep the revolving door of action going. They never, ever, either they'll amputate or they'll just keep this revolving door of treatments going and going and going, and not once telling the patient, you need to walk. But in this case, Rebecca and Nancy started a real walking regimen together. Can you tell us about that? It was a real mother-daughter effort.
We both have like those low profile, just basic treadmills. And so what we started doing was I was doing along with her for my health too. And we started, we kind of broke up the 10,000 steps a day. We broke it into 4 or 5 segments, and we were doing it on our respective treadmills, but over FaceTime together.
Mm-hmm. And Nancy?
It's awesome.
Yeah, I was at the point, the pain was still there. And I was taking just over-the-counter stuff to try to deal with the pain. And I was telling Rebecca, I just went to one of the big department stores, and I actually ran down the aisles because there was a guy I wanted to help check out. He didn't have a card. And I caught myself running full speed.
Wait, were you looking for a date?
There's still that question.
Yeah, there's more to the story, but anyway, he came up he just had one item, and I knew he was hungry, and he didn't realize it was card only. And so I ran after him when I found the store. He left my cart there and ran after him. But it was funny and sad when I came back, and I'm kind of panning, and all of a sudden it flashed through my eyes that only a few months earlier I had been riding a cart throughout that store. I could not walk through that store even once. And here I am running down 2 aisles to catch this young 19-year-old guy to buy.
Oh, then it definitely was a date.
I was going to say, wow.
That's special.
No question about that, right?
Or what? I will just interject this thought, because I think it's, Kim gives people backdoor physician access that, we as physicians use all the time. I mean, if I have a question about something, or if a family member calls me and says, "Hey, I need to go do this, this, or this," I can usher people, get them in the scene of Goodfellas, right, where he takes that girl through the back door,
Right.
whatever it was, and like
Downstairs and through the kitchen and out to
yeah,
the
exactly. I mean,
outlet.
like it's sad that because if not for folks like Kim and these organizations and Facebook, which I think social media is good in that sense, Nancy would have lost her leg and she probably would be dead by now. I mean, frankly, a major amputation at your age is tantamount to a death sentence. So I think
to live.
you just want to shake the trees to raise awareness, and we do what we can, but I don't know, it's frustrating, honestly.
It is.
Well, I'm out at lunches doing marketing. I take care of saving patients' legs all morning, and then I run out to do marketing. I'm 20 years into my career, and I still do it because I think it's important for doctors to understand.
I agree.
What they're missing, and don't think just vascular surgery and amputation, but think about the endovascular and the revascularization with the catheter and the wires first.
Yeah. And I think one of the values, I mean, there are a lot of different patients, and, we can't help every single person get some sort of backdoor, but there's, something about those patients that end up coming our way, that they have a true desire in themselves, that they're just not waiting for someone else to do everything for them. They want to be participants in their care. They want to really be proactive. And so I think that you as doctors know that when I send someone your way, one, it's serious. And number two is there's something a little different in that these patients have just that little extra amount of support to, add to the compliance, because compliance is still a major factor that leads to amputations.
Yeah,
And
they have
just
to,
like with-
and it's the same, like, I know we talked about this last week where I think you had some level of frustration with some of the folks that it's like leading a horse to water and you can't make them drink. If somebody, and I always tell patients this too, if you're willing to fight for your leg, I'm willing to fight.
Yeah.
But if you don't want to fight, meaning you still want to smoke and you don't want to help yourself out, it makes my job pretty difficult. I'll help you out, but God helps those who help themselves.
Right.
Yeah. Well, it's amazing.
People have to take some control and some responsibility for their own care.
Yes.
And that's what's been so amazing with Nancy and Rebecca. I mean, really taking, your health into your own hands. Dr. Minkus, Nancy, got you just enough blood flow to get you on your feet, get you back in action. You used to show up for every single one of our weekly events. And now, this is the first I've seen you, I think, in months.
I know.
Now she's too busy being active.
I know. I'm too busy being active.
Chasing those 19-year-olds.
Yeah, right.
No. And the other thing, too, is because just visiting and seeing Dr. Minkus and listening to him, I also changed my diet. I was a Pepsi drinker. Can I say that online? That word online?
Yes.
Anyway, I used to be a 6-pack a day drinker, and of that soft drink. And I gave that up 8 or 9 months ago, also because my daughter gave up something too. And so I was able to continue, feeling for her while I was struggling with mine. But I really check to be sure that I eat healthy. I don't eat a lot of bread anymore. And I kind of look at ingredients before I buy something. So, it's because of him, I've turned my life around to help him and me keep my stuff under control. So,
see, it's the power of a conversation. That power of that conversation, Dr. Minkus, you took the time that her previous doctor did not take. They said, goodbye, dismissed her, nothing we could do. We're just going to amputate. But versus you that said, how can you be a partner in your care? Let's get you walking. Let's get your diet changed.
Right, for sure.
And you did it in such a loving way that they acted upon it.
Mm-hmm.
Well, I was also strangling her with my hands. I had my hands around her throat for a while. I said, please stop. Okay. Yeah, one of the things that I don't like is the 0-calorie drinks, 0-calorie sodas, 0-calorie juices, the artificial sweeteners they put in, a lot of the sugar and some of the typical sodas and the drinks that we take. A lot of it has a very, very deleterious effect on the blood vessels throughout the body. The sugar levels, we know diabetes is a major aspect of peripheral arterial disease. So I just feel personally, after dealing with it and seeing it in patients, even watching some family members that were struggling with some of it for a while, just to get away from any of this, the ingesting any of these weird, unusual ingredients in these drinks that are 0-calorie drinks, they're just not really good for you. As far as I'm concerned, they're poisons to your body. And if you can get yourself off of that or decrease it at least 70 to 80% of it, I think you're going to do a very good thing for your body long term. And I think Nancy's a representation of that.
And thank you so much, Dr. McNicholas, for joining us. Thank you, Nancy and Rebecca, for sharing your story, and congratulations. And we can't wait to stay on top of your progress year after year after year.